Good afternoon, everyone, or good morning. Thank you for joining National RTAP for our Stakeholder Outreach and Coordination webinar, co-sponsored by the National by NCMM. And we will be starting shortly at 2 p.m. Hi, everyone. It is now 1:59 p.m. Thank you for joining National RTAP and the National Center for Mobility Management for the Stakeholder Outreach and Coordination webinar. We'll be starting shortly.
Well, good afternoon, everyone, and welcome to the National RTAP Stakeholder Outreach and Coordination webinar. National Rural Transit Assistance Program is very pleased to be co-sponsoring this webinar with our partners at the National Center for Mobility Management. My name is Karen Dumaine, Project Manager with National RTAP, and my colleague Nellie Kubihiro from our DC office is here to assist. Next slide, please. Before we get started, let's just go over a couple of housekeeping items for today's Zoom webinar. And if you're having difficulty with your computer audio, you can call in using any of these numbers and then enter the webinar ID. Next slide. Use the chat to get help using Zoom or to share comments. Use Q&A to submit questions to be answered during the webinar. Click the raise hand to ask question verbally or to even share comments during the group discussion portion of the webinar. And please do keep yourself on mute during the presentation. The webinar is being recorded and it will be posted later on either today or tomorrow morning on our website, nationalrtap.org/webinars. Next slide. So the focus of today's presentation is on engaging with diverse stakeholders to design and implement equitable transportation services, followed by Q&A and a group discussion. Next slide. Just a little bit about the National RTAP program. We're a technical assistance center funded by FTA through the Section 5311 program. National RTAP provides free training materials and technical assistance to rural and tribal transit providers and state RTAP programs. We're governed by a review board that includes state DOT and rural and tribal transit agency staff. And you can learn more about our programs and find a wealth of informational resources on our website, nationalrtap.org. Next slide. So again, welcome everyone today. Our presenters are Amy Conrick and Judy Stanley from the National Center of Mobility Management. Amy is also the Assistant Director at CTAA. She has a wide range of experience in the transportation field. Amy's an expert in innovation and human-centered design, health and transportation, veterans, jobs, training, and strategic planning. And we're also joined by Judy Stanley, who is the Assistant VP and Education and Youth Transition at Easter Seals. Judy's areas of expertise focus on disability issues, workforce development, shared use, mobility, education, and human services, evaluation and performance measurement, I should say. Next slide, please. So we are very fortunate to have both Amy and Judy here today to share their expertise and provide some strategies for stakeholder outreach and coordination. So now I'll turn this over to Amy.
Thank you, Amy. Thank you, Karen. I appreciate it. So first, just on behalf of Judy and myself, just thank you very much to National RTAP for having us on. This is a topic that I think both Judy and I are quite passionate about, stakeholder engagement. So hopefully we'll have some interesting thoughts to share with you. Next slide, please. So as Karen mentioned, the NCMM is another one of those technical assistance centers funded by the FTA, the Federal Transit Administration, and it's operated by three organizations. My home organization, which is the Community Transportation Association of America, or CTAA, based in DC. Judy's organization, Easter Seals, and then the American Public Transportation Association, also based in Washington, DC. Our primary mission is to promote customer-centered, and we put a lot of emphasis on those two words, mobility strategies to advance good health, economic vitality, self-sufficiency, and community. Okay, next slide, please. So you might be asking, I do see some familiar names in the audience, but for those who are not familiar, maybe asking what is mobility management? We have kind of like a short and a long definition. In short, mobility management is defined as creating and managing, whoops, one second. Can't read my own words, there we go. Creating and managing mobility options at both a systemic and the system to customer levels to improve the reach, efficiency, and affordability of public transportation services. There's a bit of a longer explanation there. I won't read that right now. I would certainly refer you to our website, which I believe is going to come up in a minute in the URL, and you can read more about this there. Next slide, please. And there's our URL. There's two different URLs. There's our cheat URL, which is nc4mm.org. And then there's a fully spelled out, which is National Center for Mobility Management.org. So you can use either of those URLs to get to us. This is a screenshot of our front page. We try and put some really important announcements on that slider at the very top. And then you can see also on our front page, we like to feature not only our mission, but also our latest blog and our latest news. Next slide. So key activities for NCMM, for those of you who do not know us already, we see our website as the gateway to our resources. We have put in there an advanced search feature, so you can put in a topic and it will go through our website and pull up any resource, any document, any news item on that topic that we have posted. There's also a box you can tick and it will do the same kind of a search across all the TA centers. So that includes National RTAP, that includes the National Aging and Disability Transportation Center, and also the National Center for Applied Transit Technology, 4 of the 5 centers that FTA funds. We also have the very far right tab of our website is the Knowledge Center. We have two big resource centers there. One is on One Call, One Click, which actually will soon be branded as Level 1 MOS. And then we also have one which has an extensive number of pages and resources on health and transportation, addressing social determinants of health. You may be familiar with our e-learning courses. And again, I mentioned our blog. We try and put all of our substantive information, apart from what appears in our briefs and our white papers, through our blog. So that is also searchable through that advanced search feature that I mentioned a moment ago. And our calendar events, we track calendar events from organizations across our industry, and it's a fairly comprehensive listing. So if you are looking to see what's coming up this month, please check that out. Some of our major other activities, we offer 3-phase grants using human-centered design. The 3 phases are the planning phase, and the second phase is what can be called the proof of concept phase. We also call them learning launch grants, and then pilot grants. We provide direct TA. There's a link there where you can find any system, any community can find the individual who is appointed to serve communities within that FTA region. And you can find that out at nc4mm.org/about-us/about who we are. And there's direct contact. And that's also like, for example, where Judy's and my areas of expertise are listed. And then Judy particularly has done a tremendous amount of cross-sector work. We do cross-sector work all the time in our grants. And Judy's done an awful lot of innovative work in the states and the region where she's been working. And so we do a lot more than this, but this is just a good introduction to some of our key activities. Next, and by the way, the picture you see there is actually a real picture. I was looking out our office window in DC. You can see the snow. So it was this winter, and there went this car by with these 2 dogs hanging out. I thought it was just a cute picture, so I thought I'd share that. Next slide, please. Oh, this is just a screenshot of that looking for help page, the different types of technical assistance in addition to everything else we do that we provide. And next slide.
Amy, before you go on, we did have a comment there about from a couple people. Someone said that they assist with transportation coordination efforts at the local, regional, and state levels, and they're wondering if there is a worksheet or something similar available to get help getting comments from local groups to get ideas for coordination efforts. And I'm sure you're going to get at this in the rest of the presentation, but I did want to pose that to you at this point.
Okay, yeah, no, I'm happy to answer that. I guess the answer is there is no one answer. The best thing really, give us a call. Let's have a conversation. Because we definitely, that is a key piece of our mission, is that coordination between transportation providers and agencies and human service agencies and other agencies within the community. So there really is no one size fits all, and that kind of fits in with our approach of human-centered design. But there are several approaches, maybe not just one, but there are several. And we want to make sure that whatever resources or strategies we recommend are those that are most appropriate to what it is you're trying to achieve. So the best thing I can say is contact us, and happy to have a conversation, Judy, I, our other staff, at any point in time.
Thank you.
Sure. And then I think, is there one more slide? I don't recall. Okay, so with that brief introduction to the National Center for Mobility Management, I'd like to turn it over to my colleague, Judy Stanley, who's going to talk on our topic today. Judy?
Terrific. Thank you, Amy. And I too want to thank National RTAP for inviting us here. It's always fun to do collaborative work. I'll describe myself. I am a white, middle-aged, can I still call myself middle-aged woman with brown shoulder-length hair? I'm wearing glasses and I'm wearing a headphone. And thank you all for being here today. We're going to talk about the why of how do you engage stakeholders, diverse stakeholders into coordination, into transportation planning. We'll also talk about the what. What is the content that you're trying to engage people around? The third point we'll discuss us is the how. What kind of methods can you use to engage diverse groups? You'll hear about some lessons learned. Amy has been working closely with her grantees, and we'll have some on the ground lessons learned about how to engage diverse audiences into coordination. We're going to be sharing lots and lots of resources, so I hope you'll take this PowerPoint and all the URLs that we've attached to use it as a library for your future resource. When Amy and I have been working at the national level for years and years, and we've acquired a lot of resources. And I think that's one thing that a National Technical Assistance Center does best, is connect people. So hopefully you'll be able to connect with people and resources through those that we shared. And finally, we're going to have a discussion. We're going to have, we'd love to learn from you. We always learn from you in these situations. So we're going to leave time for discussion. Next slide, please. This work is really about doing things differently. And this is a quote from Susan Scott in a book called Fierce Conversations. If you always do what you've always done, you will always get what you've always got. So when we think about engagement, we have to think about doing things differently for different audiences, customized approach, similarly to what Amy was saying in terms of the technical assistance and trying to gather feedback from local stakeholders about what their needs are. That really has to be customized and unique to the setting you're in. The next slide, please. The first step is to really start with the why. And this comes from a researcher, author, Simon Sinek. And he talks about whenever you're starting a group process that you've got to think about the end result, the why. Why are you doing this? And I have a quote here from the Federal Transit Administration and their definition of public engagement. And it reads, meaningful public engagement does not mean that every issue or concern raised by the community must be resolved. However, it does mean that grantees work diligently to engage in a meaningful public dialogue with the communities impacted by the proposed action, listen to what they have to say, respond to their comments and concerns, and incorporate their comments into the transportation decision-making process where practical. So always start with the why when you're outreaching and communicating with stakeholders who may not have any familiarity with your topic. Next slide, please. Understanding the audience is really critical to identifying the why. And think of all of the different stakeholders. We've got business, we've got employers. Why would they be interested in coordination? Why would they want to have safe and reliable transportation? They want to have qualified employees. They want to get employees to the workplace. It impacts upon their economic bottom line. So for a business entity, an employer to be at the table, they want to ensure that the services that you all can provide, if you're transportation providers, will be able to get the employees they need to the workplace. If you're trying to engage healthcare professionals, think about their why. They want their patients to have good health so that patients don't end up back in acute care facilities and hospitals. They want patients to get to appointments, to get the treatments they need. And if you're a human service provider, like an Easter Seals affiliate around the country, you want transportation service and you want to participate in coordination because you want the individuals that you work with, the participants, to have inclusive community options. So this is just giving you a snapshot of the different whys that you could use to engage diverse stakeholders. Next slide, please. When you understand your why, that's going to help you think about the what, the content of the engagement, what it is you're addressing in your coordination effort. How will you use their input? That's a critical question. And as the person that posed the question about a checklist or a tool to engage audiences, this is really important to understand and to articulate with stakeholders is what you're going to do with the information when they share it. So are you going to develop a new service? Are you going to redesign an existing service? Are you going to change a process, your way of doing a service? And you want to convey how you're going to use the information information in transparent ways and in multiple ways. Not every person learns in the same way. I may read a brochure, I may read a marketing flyer, or I may learn by having a conversation. So you have to be really cognizant of not only communicating how you're going to use the information in a transparent way, but in multiple ways. And always providing examples from other experiences is an important way to get participation. So if you have been working with another human service organization or another healthcare provider, and you could provide a tangible example of how that entity participated and how they contributed to the design of the transportation service or redesign of the service, that will serve as a catalyst for getting increased participation. Next slide, please. One of the things that I always encourage places when I'm doing technical assistance is build the relationships with people that you potentially want to be part of your coordination effort before you have to. So let them invite them into forums and develop that trust. Let them get to know you before you need anything from these entities, before you want their input. Invite them to forums you have, invite them to an informal meeting, have a fair or an opportunity for them to get to know, if you're a transit agency, provide them with an opportunity to get to know your services and what it is you do. And help them understand your role and what your contribution to the community is, and always articulate the impacts and outcomes of your service. We're all about bottom line and return on investment. So the more that you can articulate what's in it for them, what's in it for their audiences that they serve, what kind of outcomes can they expect through their participation, that's really a critical piece of coordination and engagement. Next slide, please. So the how. I mentioned that people don't all learn and acquire or interact in the same way. Something we call universal design. We know universal design relates to the physical universal design. So having curb cuts that are accessible for people with mobility challenges or people that are pushing a baby carriage. That's what physical infrastructure universal design is. But there's also universal design for learning, which supports the notion of conveying information in different ways. So think about using technology, accessible technology, having accessible meeting spaces for people. Also establish norms and rules for participation. When you are engaging stakeholders, it's really important that people know the expectations for how they can participate. I was working with a group in the Northeast, and there were two pretty vocal people at that meeting that dominated the conversation and really usurped the perspectives and the participation of others at that meeting. And so what the leader of that group did was establish norms for the group, so the next meeting those same two individuals weren't as persistent in their vocalization. Always acknowledge everyone's voice and perspective. Everyone's voice counts. It may be that a topic that someone brings up is not relevant, and ensure that you're creating opportunity for that person to share the information at another time. I'm a big believer in measurement of process and outcomes. And so always measure what you're doing. Take stock of what you're doing. Look at the process, look at what you're achieving, and make sure that it is aligned with what you expected the process to be. And don't let don't be so encumbered with how you're engaging people that you're going to stymie the contribution and the voices of a diverse group of people. Next slide, please. Mobility management is an opportunity to create these community forums. And Amy shared with you the definition of mobility management, and I know many of you on this call, and I know you know what mobility management is. So if there are opportunities in your communities, in your cities, to either tap into existing mobility management networks, do it. They provide a forum for building relationships. It enables you to assess the mobility and transportation resources. We call that environmental scanning. And to answer the person's question, when you're doing an environmental scan, you're evaluating the transportation and mobility options that may be available in a community and descriptoring those options so that you know what that service can and cannot provide. And that's part of mobility management. And mobility management provides an opportunity to fill the gaps. People sitting at that table have resources. Maybe they come from Health and Human Services. I'm working in New Hampshire, and New Hampshire Health and Human Services is contributing to mobility management. And they wouldn't have known about the needs, the transportation needs in the community if they hadn't been at the mobility management table. It creates forums for sharing resources across riders, resource sharing across vehicles. Maybe if you've got a vehicle that's underutilized that another human service organization or another transit agency can use. So it provides an opportunity for you to know about riders that potentially could be shared, vehicles that could be shared, and costs that could be shared. Next slide, please. So we have at the local level this work around coordination, which supposes that all these different entities are going to be at the table representing various perspectives. At the federal level, we have the same push. We have a push for coordination and inclusive transportation. And the next slide, please, describes that effort. And it's called the Coordinating Council on Access and Mobility. And I hope most of you have heard about CCAM. CCAM is an effort at the federal level to provide improved transportation availability of services, accessibility of services, and efficiency. And the work brings together 11 federal agencies that provide transportation. And these are the agencies written on this slide, agencies such as the Department of Education, the Veterans Administration. And CCAM brings these entities together to look at where can we share resources? Where can costs be shared? And the Federal Transit Administration has developed some really great resources and tools about cost sharing and the CCAM effort. And our work at the National Center for Mobility Management is implementing CCAM at the state and the regional level. So I encourage you, knock on the doors of non-traditional kind of partners. On the next slide, I have some national resources that could also be useful to you. We've talked about some of these on this webinar thus far, but the Federal Transit Administration invests really amazing resources into these programs. So take advantage of some of them. The next slide, please. I started to mention that I hope that you would knock on the door of various stakeholders, people, entities, organizations, maybe you wouldn't think of before. And I love this picture. And the caption reads, always try to build connections to support transportation engagement, unlikely sources. And it's a picture of a tiger and a chimpanzee, and they're nestled closely together. And you never know what those partnerships can bring. So I hope that you'll once we have our conversation, we'll learn more about the relationships and the work that you're doing. And I believe on the next slide, Amy's going to talk about our amazing grant program and how she's seen some of what I've just talked about in practice. Amy?
Great, thanks, Judy. So as Judy mentioned, we have a long history of grants at NCMM. We've been doing human-centered design grants since 2012. I want to emphasize all of our grants have been cross-sector, and in fact, that's a requirement. If someone is coming to us and they want to work on transportation to get people to work or to jobs or to training, then their team has to reflect all of those stakeholders within the community who touch that issue. So they're all required before they can even apply for our grants. So a lot of what I'm going to talk about are based on our activities, our experience with our grants, but this can apply to any project within your community. And I guess that last bullet is also a very important one, is that all of our teams have to include at least one end user. When we talk to them about defining stakeholders, we encourage them to define stakeholders broadly. So these would be the stakeholders, and we look at our grants through three different lenses: customer desirability, operational feasibility, and financial viability. Each of those perspectives has a different set of stakeholders. So under customer desirability, your stakeholders are clearly the end user, but they could also be those who support the end user, such as caregivers, or it could be those who are impacted by the end user, like their families and their children and whoever they are supporting. Under operational feasibility, there are always a lot of stakeholders. Clearly, there is the agency that's going to provide the wheels on the ground, whatever that looks like. The other stakeholders would be people who are behind the scenes, people who are providing the technology that's going to be used, all of those who are involved in the actual operational implementation of the project. And then the one that we tend to really focus on the operational side of stakeholders. We don't focus as much, we do give lip service to, but we don't focus as much as we should on the customer desirability. And I can give you some good examples of that. And then the other area where we don't focus maybe as much either is on the financial viability. The stakeholders under financial viability are not only those who are going to fund the project that you're proposing, but they're the ones who are going to be impacted by it financially. A really good example is a hospital. So we've worked on a number of projects, a number of grants that have worked on how to ensure that patients get to their post-discharge appointments. And this is a key piece of importance for the hospitals themselves, because as you probably know, if they're, for example, treating Medicare patients, if that Medicare patient does not get to their follow-up appointments after they're discharged from the hospital, then and are readmitted for the same initial diagnosis to the hospital, then that hospital gets dinged by Medicare. They actually are penalized for that readmission. So there are a lot more than just the direct funder of a service who have a financial stake. And so what we definitely teach our grant teams is to look across all of those three perspectives that I mentioned and look and see who your stakeholders are. Next slide, please. What I'm going to do is go through very quickly 6 projects just as samples and talk to you about who some of the key stakeholders were and how they were engaged. So that first project in King County, Washington, again, that's similar to the ones I just referred to about getting patients to post-discharge appointments. And their stakeholders, they had a very broad community stakeholders. They were focused on older adults who were being discharged from the hospital. So their stakeholders included certainly a couple of different hospital systems there. Discharge planners were a really big piece because as they implemented their project, they had to have full implementation and full participation by discharge planners. But they also had like the Area Agency on Aging was a key partner. So their stakeholders were defined again by what they were trying to achieve. In Colorado Springs, a different project, their focus was on when a patient going to behavioral health or similar services, when an appointment was scheduled for them for their next appointment, whether it was for therapy or for just to see for healthcare reasons or whatever those reasons were, that the staff at the desk would actually schedule their transportation at the same time as to scheduling their healthcare appointment or the behavioral health appointment. And again, the stakeholders there, they worked with partners they'd never worked with before. It was a transit agency called Envita in Colorado Springs. And they formed relationships with behavioral health clinics whom they had never interacted with before. They also talked with homeless shelters, where you would see quite a high incidence of behavioral health or mental health issues. And just, again, had a really good coalition of stakeholders that really moved this project forward. In Trenton, New Jersey, this is a project that just launched last week. It's been a year and a half in the planning. They their focus question that they were solving for was, how can we get lower wage workers who are working in the fulfillment centers for Amazon and Wayfair and all sorts of other ones that are in the Trenton area, but still about 10, 15 miles away. And there was no direct transit to get there. So after doing an awful lot of in-depth understanding of all of the stakeholders, not only the employers, but the employees, they came up, and the community governments, they came up with a system using Waze to launch a carpool system for these low wage workers. And again, think about the diversity of stakeholders there. Okay, next slide, please. These last 3 projects are ongoing. They're all more in the planning phases with us right now. The first one in Virginia, it's pronounced Batata County, a very rural county just north of Roanoke, Virginia, if you know the area. They're in a very rural area, quite an aging population, and many older adults just forego their healthcare appointments because they just can't get there. They would have to drive, I believe it's about 40, 45 minutes into some of the more larger cities nearby. And there's just no way. So they just don't go. And as we know, that can lead to poor health outcomes. So their idea, which they are now, is now in the proof of concept phase of our grants, is to develop a weekly shuttle for these older adults and people with disabilities who will pick them up from their home or from a central location. And one of the things they're thinking of is a community center that everybody could kind of convene there within a community. It's a lot less of a burden to drive someone to this community center, which is locally located. And then from there, they would go together down to Roanoke or wherever they need to go for their medical appointments. This will also require another stakeholder, obviously the healthcare providers, because we would want them to schedule their appointments in a coordinated manner so that all the people going from, you can see the name of one of the towns there, Eagle Rock, that all their appointments can be on Wednesdays so that they can all travel at the same time. So there's quite a bit of coordination there. But again, think about from the stakeholders' point of view, especially from the healthcare providers, what are they getting out of this? They're going to get patients who have better health outcomes because the doctors are better able to follow their progress and to catch things early on before they go into a crisis stage. For the older adults, they feel empowered. They don't want to bother their families, and their families are, again, another stakeholder. So they're taking into consideration their desires, their needs. They have lives, they have jobs, they have families. And so the older adults feel way better. They've said this to us, that they're much more happy if they can kind of have an active role in finding their own transportation to where they need to go. So all of these projects, again, you can see that we look at them from, as Judy mentioned, from the different stakeholders' point of view, and make sure we address all of those. If you drop one of those stakeholder point of views, then you have a potential that your project will not be successful. 2 other projects I'll mention very quickly. One in North Charleston, South Carolina. There's a series of 5 neighborhoods there that the last grocery store, I think, pulled out about 10 years ago. And there's a major 4-lane highway that intersects these neighborhoods, and there's no way they could walk to a grocery store, much less try and carry home grocery bags. It's very expensive to take a taxi or ride-hailing service. So we're working with them to figure out how we can help facilitate their trips to healthy food that they can access in full-service grocery stores. Again, the stakeholders that have been involved in that project, they've had the local food bank, they've had representatives from these low-income neighborhoods, and clearly the city is very much involved in this project, which is they've had a very active role. And the last project I want to mention is in Ware County, Georgia. If you know the Okefenokee Swamp, it's very close to there. And they have several, especially in one corridor, they have several manufacturing concerns that have incredible turnover in workers. And not always, but sometimes the reason for that is a lack of transportation. So their concept is to use a software that the state DOT has bought and is making available to all the communities to help coordinate rides. And then the providers of those rides in their plan is that they will be the local faith-based and other nonprofit organizations who have vehicles sitting idle. I know this is kind of like one of those holy grails that we've talked about for years. So we're really cheering them on and supporting them the best we can, because we'd love to see someone crack this nut. And their idea, again, is to get all of those vans, those faith-based communities and nonprofits to help form a network that can then get those lower income workers to the jobs in a reliable manner. And so they can maintain those jobs, so they can move up the ladder and they can improve their economic well-being.
So Amy, you have a couple questions, and I'm going to ask you one, and then I'm going to invite Richard Price to ask his question out loud if he's comfortable.
Just
but
nice,
we do I know Richard, you've been voluntold, but we do have a question about all of these sample projects that you've been giving. They're great examples, and we have a specific ask for case study resources from any of these examples that you've provided. Are there any case studies? Are there any written up examples from these projects that you've mentioned available for the public to read about as they're happening? I know at the end everybody writes a project, but while it's happening and while the project is developing, is there anything people can access now?
So the best I can offer you is, so if you go to our website, which again is nc4mm.org, the second tab over are, I think they're called grants and initiatives. And if you click under that, if you look at NCMM's grants, you can then see all of the projects that have been completed. And what we actually do is each of our projects, at the end of the planning phase, we have a pitch session. So they literally get 7 minutes to pitch their idea. So you can learn more about what they look like at the planning phases. And then at the end of our grants, when they finish the pilot phase, and we're just kind of wrapping up. Well, we've had one set of grants go through all of the phases and go through to the pilot stage. And there are videos of them talking about their concepts. So we believe a lot in videos, more so probably than case studies. We think it's more engaging for you to hear directly from the participants and not from us. So as much as we have from them, they're posted on our website. We still have more to post. So anyway, so you'll see things as they finish the phases, and those are posted to our website. In terms of in-phase work, we don't really have much up there. But again, we do describe all of our projects, including our current planning projects. And give us a call. We're happy to talk you through what's going on with that project.
Yep, and Amy, I've just shared the grants page from your website.
Thank you.
And if you scroll down, I'm speaking specifically to Tammy. If you scroll down all the way at the bottom, there's the active and the past community grants, and below that there's the additional resources, and there's the open opportunities, and so forth. And so there's a wealth of information there. So definitely take a look. And so Richard, if you are able to talk, I've allowed you to talk. I think your question would be very helpful. Are you still here?
Thank you, Nellie. I appreciate that. And thank you, Amy. Thank you, Judy. I'm just going to put a plug in. I love NCMM. I live for your newsletters because they help populate my newsletters. So please keep holding up.
He also lives for National RTAP's newsletters.
And I just love National RTAP because
I just want to put that out there.
Help populate my newsletters. So, and this is Richard Price. I'm with AASHTO, and I work for the Council on Public Transportation with NTAP. So thank you both. I noticed that I thought this was a stakeholder. It was all about stakeholders and transportation coordination. And again, both not only professionally, but personally, here in Arlington County in Virginia, where I live, I know stakeholder involvement and outreach is important because it can really help move transit project along. Community involvement is very important, but then in a lot of cases, there are those who are the NIMBYs of the world, the people who don't want change, and they just sort of like everything the way it is, and it should be that way for the rest of their lives, so on and so forth. And I was just wondering, I heard the word stakeholder being talked about in these examples, but it wasn't expressed how it moved the project forward. How was that project, and how was the stakeholder involvement and the outreach done in each of these projects to help move it forward? And that's all I want to say. And thank you so much for your allowing me to ask the question.
Okay, so I'll take a stab at that. So Richard, I told you go easy. That was not such an easy question, but that's all right. We'll take it. One of the big things that we emphasize in our grants is that you don't, and we find this, and actually I'm going through this personally now, and I'll share that story in a minute, but projects sometimes kind of get developed by planning boards or what have you, and then they're kind of foisted on the community. And it's no wonder you don't have stakeholder engagement, or you don't have people saying, oh yeah, bring that project on into my neighborhood, because you don't, they never engage them to start with. So that is why in our grants, it's incredibly important. I know Judy does this in her work as well. You have to foster ownership of the project, and you're not going to foster ownership of the project unless they're part of it. Let me give you one example, just again from my personal life. There's an intersection very close to my house, and there is a mega church going in there, and the land was zoned residential, and all of a sudden they're before the zoning appeals, and they're asking for it to be rezoned or for a special exception so they can build this mega church. And the staff had already submitted their entire report and submitted it to the board. Then and only then does our neighborhood, which is going to be directly impacted, get notified. So I think there is so much cynicism about, and this is not the first project that I've had this happen to. There's so much cynicism about projects that are created and formed on the outside. And then because it's required by federal highway or federal transit, you have to do your stakeholder meetings. The public is again, very cynical, because the sense is that the government agency is just ticking the box. They're doing their stakeholder outreach. And what the stakeholder outreach really means is, here's the project. It's, 99% already planned out and approved. So, take it or leave it. And so I can certainly understand why people don't want it, why they become NIMBYs, not in my neighborhood, or not in my, not in my, I can't remember what it stands for. Not in my backyard. That's what it is. So that's understandable. And we try and circumvent that from the get-go by, if we had been involved in the planning and the thinking about that church, that mega church that wants to go in, there wouldn't be such resistance. So, but the positive flip of that is not that there wouldn't be so much resistance, but that it could be a positive thing, that we could embrace that church, or that we could embrace whatever's happening, or we can embrace that transportation project because we're part of it. And stakeholders clearly have to go in with, you've probably all heard that term, WIFM, and it's something that I keep in my back pocket all the time. What's in it for me? If you don't understand the WIFM from everybody's perspective, you're going to lose them. So Richard, I don't know if that answers your question. Judy, I don't know if you want to kind of chime in there at all.
I think in the work that we've done, we see that the stakeholder engagement leads to better outcomes long-term and leads to sustainability. And it makes the process most efficient. Entities don't have unlimited resources. You want to use those resources in an efficient way. And the more that you can justify that what you're doing is related to the needs of people that are impacted by that service, the better you'll leverage resources. So I think if you think about long-term outcomes and sustainability, that stakeholder input is really critical.
Well, I'm sorry if this makes your life harder, Amy and Judy, but just to add on to Richard's question, we've been doing a lot of technical assistance with groups that are hoping to get their social programs connected to transit. And one of the issues that comes up time and time again when I'm reading transportation plans for states and localities is that in their outreach, like one of their key takeaways from their surveys is, oh, we need to hold more stakeholder outreach meetings outside of our offices so that people can come to them. They're not marketed online, on websites. They either mail, the way that they market these opportunities for engagement aren't necessarily geared towards getting people, particularly in rural and tribal areas, aware of these opportunities to engage and then able to go to these meetings and to engage in this. So I guess what I would say is, how could we potentially increase the opportunity and the likelihood that we get the stakeholders engaged in the process. And so that the change can happen. And then we do have another question, and I will invite that person to talk if you feel that you've answered this question.
Actually, I have one last slide, which I think I want to make sure I get some of the points in there. But my take on what you're saying, I like to go back to that phrase from the disability community, nothing about us without us. Is that right, Judy? Did I get that right?
Mhm. Mhm. Yes.
Because people have to be able to see themselves in the solution. If they can't put themselves into that solution, if they can't see themselves, they're not going to be interested. So again, your stakeholder engagement is going to be way less. So Judy, did you want to add anything to Lori's question?
Michelle raised a really good point in the chat. She noted that there's a difference between outreach, which is typically short term, and engagement, which is long term. And I equated those two terms to outputs. You know, when you're trying to measure the number of rides, the number of riders, those short term, really snippets of data, to engagement, which is really the change process, right? It's the impact of what happens because of a meaningful long-term participation. So I exactly agree with you, Michelle. And I think we have to push each other and the field to talk about the impacts of engagement. Having 15 meetings, having 15 outreach opportunities, if it doesn't result in any change in what you're doing, is meaningless. And so I think we can come up with and help each other think about, how do we know engagement is working? How do we know engagement is effective? So, Amy?
Okay.
Okay, and then and Jolie Dixon had a question about your projects before you move on.
Well, actually, let me finish this slide real quick, if you don't mind. And this is my last slide, and then we can spend the rest of the time in discussions, and we'll get right to Julie. Would that be all right?
Yes, ma'am.
Okay. All right, great. So the last thing I wanted to do, and again, those are 6, and we have many, many more projects in the hopper right now. But what I wanted to do is just talk about a couple of things that have been the hardest things to accomplish in these projects. And we're struggling with this right now with some of our projects. Is the hardest thing, I think, is stepping outside your comfort zone, particularly if you are a planner. This is incredibly difficult. Planners are so used to using their data, using their models, using their peer communities or peer examples, and then, you know, using their analytical skills and saying, well, this looks to me with all the data points that this is a really good solution. And again, what human-centered design emphasizes that doesn't often happen in that planning process is that outreach from the get-go from end users. We have one project right now that we're really having to do some remedial work with, because they went through the entire planning phase and they didn't do the community outreach they should have. And right now, their project, a key piece of their project that depended on community involvement is in jeopardy, because they didn't reach out to them the way they should have, even though we pushed and pushed and pushed. So going out and talking with multiple end users. And again, remember those 3 lenses I talked about: customer desirability, the operational piece, and the financial piece. All 3 of those are equal legs of the stool and need to be addressed. One of the ways to kind of get over, if you're in transportation and you're working, say, on a behavioral health project and you're very uncomfortable, one of the best ways to do that is to pair up with someone who is more familiar with that. So the person who is familiar with, say, the behavioral health, they're your entree. They know how the system works. They understand language that is effective, but you're the new set of eyes. You see things differently, and you will pick up on things that, because they are so used to that space, they don't pick up on. So that helps you get outside. You have a partner, you're in a pair. So that is a really big key that's been helpful for our teams in reaching out their end users. And again, that meaningful engagement, I think we've talked about that already, but it's not lip service. They've got to have a stake. And again, they've got to see themselves within the solution. They've got to see themselves within the problem first, and then see themselves within the solution. That second bullet is that we've seen some of our teams, all of our teams have transportation team members. And what sometimes tends to happen is that once the project gets rolling and everybody's really engaged, and then as it comes down to more of the operational nuts and bolts, the other team members kind of drop off. And it's like, well, after all, this is a transportation project. And so what we teach our teams is it's very, very important to keep them engaged. You have to constantly refer back to their ROI, their return on investment. You got involved in this project in the beginning for a reason, because it's very important to you, whether you're a healthcare, whether you're an employer, whether you're a city who's trying to improve grocery access for your neighbors. Remember that. You have to constantly remind them of that, and don't let this kind of fall back. I often like to use a phrase that says, nobody uses transportation for the sake of transportation. Everybody uses transportation for the sake of getting somewhere else. I mean, nobody's taking a ride to the bus terminal just to do that. So transportation is a means to an end, and we always have to have that end involved. A third thing that's hard for our people is moving from planning to implementation. They do a tremendous amount. So the teams that do this really well, and there are different levels. They do so much work in the planning phase, and then they're like, okay, now how do I actually implement this? And that's why for us, that middle phase of the grants, which is our proof of concept, or what we call our learning launch grants, is a key interim step. Because in that step, you actually implement the project on paper. So it allows you to identify any piece of the project that you're like, oh, wait a minute, how is that going to work? Or, oh, I didn't really think about that. And you plan the entire thing out to the nth level of detail. And then it's so much easier to implement after that, because so we need that bridge from planning to implementation. And then the last piece is the financial piece. It's hard to estimate costs for a service you've never run before. It's very hard. We have all sorts of tools we can use, and I've worked with communities on this, but it's a tough piece. But without that, you cannot go for that sustainable funding. I'm pleased to say that several of our grants have actually received sustainable funding, either from their state DOT or for some other sources. But if they didn't keep those funders and potential funders ROI in mind, I don't think they would have been as effective. And then the other thing that I like to think about with our grants is the fact that they've gone through such a rigorous planning process. When they go to submit applications for grants or for funding, I think people like to think that the funders kind of take notice and say, wow, you've done a tremendous amount of work. This isn't just an idea you're floating and you want us to fund. You've really thought this through, and you've really engaged with the stakeholders you need to be engaged with. Okay, Nellie, thank you for bearing with me. I just wanted to get those points out. And now I think Anjoli, is that how you pronounce your name?
It's Anjali.
Anjali, I'm sorry, it's a gorgeous name. Sorry for not saying it right.
I just had a question for those projects that you may have that have already gone through the pilot phase and have substantial amount of data. If you all would consider maybe submitting it to RTAP's new Tackled or Technical Assistant Coordination Library for review. So it's, it's a good database and people can search and find information on it. And just to know if you all have considered that.
We'll work on that. We're so busy doing the grants that it's hard for us sometimes to kind of pull back. But yeah, no, that's a very good suggestion. Thank you for that.
Yeah, we've submitted, Anjali, we've submitted other products that we've done that capture information about the grants and other technical assistance work. So some of this is already in Tackle, but maybe, Amy, we could figure out a way to capture information about the grant work specific and include it in Tackle, because it does represent coordination.
Absolutely.
Yeah. And Judy and Amy, I think we also had another question, which I'm gonna release live, regarding community engagement. Have any good templates been released that can be shared to guide these communities on how to do it well?
I've developed, well, in my technical assistance, I work in regions 1 and 5, and my colleague Brandon Rossio at NCMM works on 4 and 7. And in our technical assistance work, we've developed tools. So I'm happy to share those with you. Amy, do you have tools in the design think stuff that could be useful?
So yeah, and as Judy refers to design thinking, human-centered design, same terms. So if you hear them, they're interchangeable. The tools that we have really focus on, we've got 2 kind of sets of tools I can think of. They really focus on the early planning stage. One, we have a whole, if you go to the NCMM website and you look under the very last tab, which is our by topic, our resources tab, look under by topic, we have a whole bunch of surveys that people can use. That being said, we actually do not recommend surveys as a great way of understanding your stakeholders, because it's only through, again, and getting back to our comfort zone, it's only through those conversations that happen that you really can allow stakeholders, whether they're at the funding level or the customer level or the caregiver level, for their real thoughts to kind of emerge. Surveys are good for a first blush look at something, but they really aren't going to lead to engagement. The other tools we do have, and we use with our grantees, and I believe they're being revised right now, but I can certainly send them out. We have tools on how you conduct a really good focused interview with end users. And so we have some guides along that.
Okay.
But our thought is that once you get into the process, that those conversations just kind of roll automatically or naturally.
I think so. And I was trying to find that tab. Is it under Knowledge Center?
Yes.
Okay, great. So I'll just share the tab where people can look at the resources by topic from NCMM, and we will share whatever resources that Amy and Judy compile to the audience by email. So
and please don't reach out to us by email. We're happy to kind of respond that way too.
Of course. And so, yeah, if we don't have any more questions that are open, we did have a couple of discussion questions planned. We do want to keep in mind that it's 2:58. So if anyone in the audience has a particular strategy question that you see on the screen, I think we have addressed a lot of these, but perhaps maybe there's 1 or 2 that you might want to address, Amy or Judy.
Yeah, I'm just wondering if you're a transit agency, if you represent that interest, how have you reached out? What strategies have you used to reach out to human service and to various stakeholders that you have found to be particularly effective? And then on the other side of it, if you're a human service organization, you're a mobility manager, what strategies have you used to share your voice and perspective with transportation planners and designers? And then my kind of related question, I'm all about measurement and outcomes. How do you know those strategies are effective? How do you know they've really made an impact? I would love your feedback.
Do you have particular options that you would like? I can create a quick poll maybe.
No, just I'd love anyone, and even after the webinar, if people want to reach out.
Yeah, please raise your hand if you would like to answer the question, and I'll allow you to speak and or answer in the chat. I think IPAC, if you would like to speak your comment, you're able to talk.
Oh, great. Hello, everyone. And Judy and Amy, thank you very much. This was a wonderful session. I'm IPAC Shanley from Texas A&M Transportation Institute. And I was, Amy, you made a great point about surveys. And that is something I keep in mind continuously, how to reach out, how to learn better about the barriers, and how to really work with communities effectively. And one concern that we are being hit though, how we are going to get a representative sample or a large sample with other tools like interviews, like what is the best way to move forward, and how will we make sure that we have enough information? I don't know what is enough though, especially when we are talking about hard to reach populations and our marginalized communities.
So real quick, I know we're at 3 o'clock, but just an incredibly quick example of, so researchers, we are very focused on getting a significant sample. What human-centered design teaches you is that that's not always just the one approach that we should take. And a really good example, Procter & Gamble, huge company, when they were developing the Swiffer, they interviewed, I think it was 14 people, not 100 people, not 1,400, not 14,000. They interviewed 14 people. And that from that was how they developed the Swiffer. That's where they got. So what's more important and I know this is really like probably heresy to a researcher, but what you're really looking for are insights. And those insights can come as long as you allow those in-depth interviews and observations to take place. And they can come from a small handful of people. You have to be very careful about how you choose those small handful of people. But how do you know when you get enough? I've had this experience in other projects that I've worked on. When you start hearing the same things from the people you're interviewing, then you're like, okay, I think I got that one.
Okay.
So IPEC, if you want to email me separately, there's a lot of work around this in human-centered design on this very topic.
That sounds lovely. Thank you very much. Appreciate it.
Sure.
Yeah, I think everybody would love any of the resources that you have, Amy, so we could share with the whole group. But another resource is Tackle, and I'm sure Karen, Amy, or Judy could talk more about it, but they do have a lot of resources across all of the FTA-funded technical assistance centers on all of these topics. And so you can go there and find resources from National RTAP, from NCMM, or from NADACT, which also does a series of really good surveys and really good outreach. I see we have Carrie Diamond, or we did have Carrie Diamond at one point from NADACT. They are very good at reaching out, especially to marginalized and people who have cognitive differences and things like that. So we can definitely pull together some resources answering some of those topics. But I did want to mention that Tackle is a great resource for everybody. We have a series of upcoming events. Thank you. It's over 3, including an intercity bus peer roundtable coming up next week. We have increasing transit marketing, particularly post-COVID. We have a transit managers peer roundtable. So these topics, for those of you who are operators who want to talk more about this, and how, please come, bring your questions, talk to your peers about how and they're doing what they're doing and if it's working. We also have website builder workshops on our website builder 3.0 tool, which is free. We have experts that can help you use our pre-built templates to better advertise your services on your website, and we can host them for free via National RTAP. Additionally, we have increasing rural service planning and route design and webinars coming up. So feel free to contact Judy and Amy, as well as National RTAP, and we'll be happy to pull together whatever resources we can and share them with the attendees or in the slideshow as a handout with the recording of this event. So thank you so much for coming. If you'd like to stick around, please do. Otherwise, if you have to go, thank you for coming. Judy, yeah. In fact, Judy had a comment. I just want to make sure that you got before you left that the method of outreach. If you want to go, Judy.
No, I just was responding to IPEC's question, really, and you use a survey approach, a methodology for varying different purposes than you do an interview or a more customer-centered kind of data collection. So it really depends upon the why you need this data, and what you're going to be doing with it is going to drive the method.
Thank you very much, Judy. Yes, certainly. And I think we also need to be more and more interested in, as you mentioned in your presentation, the why, really. And there's a lot of great learning process from there. Thank you very much. Really appreciate it.
Thank you.
I'm really interested in the places where the surveys have failed. to gather the information needed, or the outreach has failed. Because I think we're starting our own grants, and we'd like to know that information so that we can help them not have to go through that experience. So I definitely will be reaching out to you, Amy. Thank you so much, everyone. Have a great rest of your week.
Thank
enjoy
you.
your
Bye,
weekend.
everybody.
Bye.
Thank you.
Thank you.
Bye, everybody.
Bye, everyone. Thank you so much.